Hi friends, Laurel Desnick here with the Health Department update for January 28, 2022. This week we are in the midst of our biggest surge ever. At the testing sites at the hospital and the Health Department, approximately half of all COVID-19 tests are turning up positive. In the past 7 days, we saw an average of 70 new cases a day in the county. These numbers indicate very high spread of infection in every part of the community. Vacation travel and social events continue to drive much of this spread. Teachers and students, doctors and nurses, church groups, business and government offices are all affected. Grocery stores, gas stations, bars and restaurants, banks and daycare centers are struggling to stay open with so many employees homesick. Montana also saw a 97% increase in COVID-related hospitalizations in the past 2 weeks. At the moment, Livingston Healthcare is fine, but there is concern about more hospitalizations in the coming days. Typically, hospitalizations for COVID-19 lag 2 to 3 weeks behind overall cases. The vast majority of those hospitalized for COVID are older, have an underlying chronic illness, and are not vaccinated. The most important thing right now is for every one of us to stay home if feeling unwell, even with very mild symptoms. Omicron seems to start with a scratchy throat, sinus congestion, fatigue, and muscle pain, especially in the low back. Fever, chills, and upset stomach are also common. These symptoms are generally much worse in those who have not yet been vaccinated or boosted. Thankfully, most children, especially younger than high school age, experience quite mild symptoms and recover quickly. As soon as one's health returns to normal, it is fine to go back to usual activities, especially if vaccinated and wearing a well-fitting mask when appropriate. A COVID test is most important if you live or work in a high-risk setting. This includes living with a frail relative or working in healthcare or other essential services such as the post office or a school. We currently have 2 kinds of COVID-19 treatments in the county, a pill form for home use and an infusion which is given at the hospital. Both treatments are most effective when started as soon as possible after symptoms begin. As long as supply is available, treatment is offered to those with a positive test and risk factors for more severe illness. Older people and those with chronic health conditions benefit most from treatment to prevent hospitalization and death. The Health Department now offers free rapid test kits to all businesses, schools, government offices, long-term care facilities, and essential and frontline workers. Please check our website for details. We offer free drive-through testing for the general public 5 days a week at the Livingston Fairgrounds, 9 a.m. to 1 p.m. We also test at Gardner and Wilsall weekly. Results are available the same day as the test. Free federal test kits have started to arrive for those who have registered for them. If you test yourself and are positive, you can report the results online on the Montana DPHHS site. A link is provided in our attached script. The state will forward these results to our local health department, and contact tracing will continue as usual. Free vaccines, which are very effective at preventing severe illness and spread of COVID, are available in Livingston, Gardner, and Wilsall weekly. Our clinic for children and teens ages 5 and up will be this Saturday, January 29th, at the Livingston Fairgrounds 1 to 4. Registration on our website is encouraged. Thank you, Park County.